So hey guys, welcome back to the Friday Q&A with Dr. Dre. As you can tell from the title, today I'm going to be addressing all of your questions about dark spots on the face and what can be done to get rid of them, what causes them, and do various things sold over the counter or in Sephora even help or work for these problems. I get a lot of fantastic questions in this arena, so I wanted to focus today's Q&A exclusively on questions that I get with regards to dark spots. And if you're new here, welcome. My name is Andrea. I'm a dermatologist. I post day in the life of a dermatologist vlogs, as well as these Friday skincare Q&A videos where I address very common skincare concerns from the perspective of a dermatologist. So if you like this video, I encourage you to give it a thumbs up and subscribe for more content like this. All right, with that, let's get started. So today I'm going to be talking about dark spots that come up after acne or after a rash. And this is called post-inflammatory hyperpigmentation. Now, post-inflammatory hyperpigmentation tends to be more prevalent and more noticeable in individuals of darker skin types. While many of the interventions and over-the-counter remedies for this problem are very similar and are very similar to those used in melasma, these conditions are not the same thing. So unlike melasma, post-inflammatory hyperpigmentation occurs when inflammation in the skin results in increased pigmentation, either in the top layer of the skin, the epidermis, or the deeper layer of the skin, the dermis. And sometimes the pigmentation can occur in both layers. It happens after a variety of skin conditions, like healing acne, rashes, medications, or after a procedure where there was quite a bit of irritation to the skin, such as a chemical peel or a laser treatment. Unlike melasma, post-inflammatory hyperpigmentation usually remains localized to the area of the prior or ongoing inflammation. And while many of the treatment interventions and advice for post-inflammatory hyperpigmentation are similar to melasma, unlike melasma, for the most part, post-inflammatory hyperpigmentation tends to improve and even go away with time, sun protection, and keeping in mind that the prior skin insult driving the inflammation is under good control. So tips for dealing with dark spots. Well, first and foremost, one of the most critical things for you to do is to see a dermatologist or healthcare provider for evaluation and management of your skin concern, to make sure that the primary skin process is on the right treatment path. If it's not, then it will continue to worsen the dark spots on your face and make the problem persist longer and potentially more permanent. Additionally, there are many things that can cause dark spots on the face, so it's also a good idea to make sure that you're dealing with post-inflammatory hyperpigmentation before trying to employ any remedies yourself. And the second tip is if there's something that's irritating your skin, you absolutely have to avoid it. That includes occlusive cosmetics, irritating fragrances, harsh scrubs on the skin, excessive peeling agents on the skin, etc. Step number 3 is probably the most critical, and that is photoprotection. Sun exposure not only drives increased pigmentation in the skin, but leads to inflammation and persistence of chronic irritation in the skin that further drives ongoing discoloration. Now, most sunscreens labeled broad spectrum do a pretty good job blocking ultraviolet radiation from the sun. However, we're starting to learn and understand that in the case of both melasma and post-inflammatory hyperpigmentation, not only is ultraviolet radiation from the sun a component in driving the discoloration, but also visible light. So sunscreens and makeups that contain iron oxides are effective at blocking visible light and have been shown to help improve both melasma and post-inflammatory hyperpigmentation much better than simple sunscreens that only block ultraviolet radiation. I will do my very best to find some examples of these and link them down below in the description box. All right, and so moving on, what kinds of creams and things can help clear the discoloration faster and improve the brightness of skin? Probably the mainstay ingredient in treating discoloration of the skin and melasma is an ingredient called hydroquinone. this ingredient inhibits the enzyme that's important for making pigment in our skin. It is actually very safe and has been used for many years in the treatment of this concern. It is available over the counter in a variety of creams such as Ambifade cream or Nadiola, both of which I will link down below. Higher percentage strengths are available in the United States with a prescription. Hydroquinone is safe to use twice a day for up to 16 weeks, but it's important to take a break from it. If you're going to use a hydroquinone containing cream, you should know these things. First of all, the most common side effect with this ingredient is skin irritation. So sun protection becomes even more critical while using this ingredient. The second concern that you should know about is that chronic long-term use of hydroquinone are associated with the development of something called pseudo-ochronosis, which is a black discoloration of the skin that is incredibly disfiguring and permanent. Additionally, women who are pregnant or considering becoming pregnant should stop using hydroquinone containing creams and topical ingredients. Now, laboratory studies have suggested that in very, very high systemic doses, hydroquinone could potentially cause cancers. There is no data at this time to suggest that topical use of a hydroquinone containing cream can lead to cancers. Probably the gold standard prescription cream is something called Triluma, which combines hydroquinone, which, as I said before, inhibits the enzyme that makes pigment in the skin, combined with retinol, which also inhibits that enzyme, as well as helps naturally turn over the skin cells a little bit. And the third ingredient that this cream contains is a steroid, which will help to combat the inflammation in the skin, as well as inhibit the enzyme that makes the skin discoloration. This prescription cream is the most well studied for this problem, continues to be the most efficacious in treating this skin concern. Another prescription cream is something called azelaic acid, which is a dicarboxylic acid made by a yeast that naturally lives on our skin. It too can inhibit tyrosinase, the enzyme important for pigment production, and can be effective in brightening the skin. And then the last prescription drug is something called mequinol or Solage. It works similarly to hydroquinone but tends to be less irritating than hydroquinone. There are a variety of ingredients that we've learned in the lab that also can inhibit the enzymes and many of the processes that drive pigmentation and abnormal discoloration of the skin. These are now available in many things over the counter. Examples of these ingredients include vitamin C, soy, arbutin, emblica, licorice extract, and green tea extract, as well as many others. Probably the ingredient that I get the most questions about is vitamin C and vitamin C serums. Vitamin C is an antioxidant that can be helpful in discoloration when applied to the skin. Vitamin C is not very stable when applied to the top of the skin, and so it's very dependent on the formulation in terms of its pH and stability. So it is very difficult for me to recommend a vitamin C serum because of this. However, there are a few out there that anecdotally and affirmatory in the comments section here seem to help, which I will link down below. The second ingredient that I'd like to talk about is something called is topically applied soy. Soy can suppress reactive oxygen species as well as inhibit some of the processes of pigment formation in the skin. And it is available in the Aveeno Positively Radiant broad spectrum SPF 30 sunscreen, as well as Aveeno also has a nighttime cream, I believe, that has soy in it as well. And I'm bringing this up here because I myself have actually tried this product and did notice a skin brightening effect with it. So I will link this down below. I also will list below all of these ingredients that I've mentioned here and some others with products that contain them and anecdotally have been observed to be helpful in skin brightening and discoloration as well as melasma. Do bear in mind they have the potential to be irritating to you. And so in addition to sun exposure, skin irritation is your #1 enemy when it comes to improving the discoloration and dark spots on your face. So it's okay to try them out, but if you find they're too irritating to you, probably not a good idea to continue them. I also get a fair number of questions about vitamin supplements and oral supplements sold over the counter that could potentially have a skin brightening effect. And so I'm going to talk a little bit about those. So there are a few orals that are prescribed or shown to be effective for post-inflammatory hyperpigmentation. Tranexamic acid, most commonly utilized in Southeast Asian countries, for example, has been shown to be effective for melasma. Its efficacy in post-inflammatory hyperpigmentation, however, has not been established. This is a medicine taken by mouth. Which interferes with some of the blood clotting cascade. It does have side effects, namely nausea, diarrhea, menstrual irregularities, headaches, and back pain. It does appear to be relatively safe, however, and there have been no reports of adverse blood clotting problems with people taking this for melasma. So talk to your dermatologist about it as a potential option for you if it's something that you're interested in. The second ingredient is something called Polypodium leucomotis, which is found in Heliocare. This is an ingredient derived from a fern plant. It is an antioxidant and is helpful in clearing sun-damaged skin cells. It has also been shown that when taken consistently along with photoprotection practices, this ingredient improved the appearance of melasma, and therefore it's thought that it might also be helpful for post-inflammatory hyperpigmentation. And the third supplement that I'll talk about is something called glutathione. Glutathione is an antioxidant. It's present in cells, and it's also found in high abundance in broccoli and asparagus. A study done in Thailand looked at individuals with melasma taking 500 milligrams of glutathione daily in comparison to a placebo pill. The pill was taken once a day for 4 weeks, and at the end of the study, the researchers observed a statistically significant improvement in the appearance of melasma in the group taking glutathione 500 milligrams daily for 4 weeks. However, there have been no long-term studies to establish efficacy in melasma and or post-inflammatory hyperpigmentation. I also get a lot of questions about chemical peels and lasers and light treatments and surgical procedures for discoloration, skin brightening, and melasma. So both chemical peels and light-based laser therapies like intense pulse light, or a Indi-Yag laser, for example, have all shown variable to marginal success rates in improving melasma and or post-inflammatory hyperpigmentation. Additionally, I would caution you because these procedures offer the risk of further irritating the skin significantly and causing and or worsening more post-inflammatory hyperpigmentation. And the last and final thing that I'll touch on, because I get a ton of questions about, is microneedling. So microneedling is a minimally invasive procedure in which tiny little needles are used to puncture the top layer of the skin. It essentially creates a tiny micro wound in the skin that allows kind of a new bed for healing and rejuvenation of the skin. This procedure is performed by dermatologic surgeons, for example, and is an area of active research, and the research seems to be suggesting that this procedure may be helpful for a variety of skin disorders. However, larger and more randomized controlled trials are necessary to demonstrate efficacy and safety of this procedure. It has been demonstrated to show some benefit in melasma. So stay tuned, but I do caution you against using devices sold in the stores or at-home derma rollers or microneedling, because as I mentioned, this is essentially creating a micro wound in the skin, which opens up the opportunity for many complications like infection or scar or worsening of your discoloration. So if you're considering this procedure, make sure that the person doing the procedure is trained in and experienced with the procedure. Can't really comment on how efficacious it is. There are reports in the literature of skin surgeons doing this procedure and finding it to show some improvement in melasma. So stay tuned. All right, guys, so that's going to conclude the Q&A for this week. I really hope this was helpful to you in addressing all of your questions about dark spots on the face. If you enjoyed this video, please give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next skincare Q&A. Bye!